name's Jason Shiflett. I'm a physical therapist and I work at Physical Therapy Balance Center in Germantown.
All right, so can you tell us about headaches that come from the neck, also known as cervicogenic headaches?
Typically they're one-sided headaches. They can also give you face pain and, usually they're left side, right side, sometimes both sides. They typically come from neck problems, upper trap problems, sometimes thoracic can be added in there. Muscle tension, alignment issues, disc herniations. They can give you even symptoms into the arms and hands if they're really bad.
And then how do they typically present from what you've experienced when it comes from a cervical issue?
A lot of times there's going to be a postural factor in there, a lot of neck tension, but they're, a lot of times often they won't even feel it in the neck, they're just feeling headache pain. And, it's kind of shaped like a question mark. And it can start here, kind of question mark up into the eyeball sometimes. So, very frequent. There's multiple components to that, but typically neck causing head pain.
And then what actually osteopathically is happening in the neck that causes this? What's occurring there?
I always find alignment issues of the 7 cervical vertebrae. Maybe not all 7, but at least a few. Neck muscle tension, abnormal tension one side or both sides. Posture usually goes hand in hand with that, with a forward head posture, head jutting out that way, which can carry into the chest. If you do see that, you're going to see some things in the thoracic spine also. So forward shoulder can be another component too. So there's multiple causes, and the key is going after each individual one and knocking them out.
Do you find it's mostly cervical spine issues or myofascial or both?
Both.
Okay, so it can be.
Yeah, they go hand in hand. I don't think I've ever seen an alignment issue without a muscle component, without a fascial component. It's just the trifecta, they all overlap. So knocking out all 3 is your best course of action.
And what is your technique of choice when you treat these?
I like to use multiple techniques, but strain counter strain, probably first place I start, which is very indirect, non-aggressive osteopathic technique mixed in with myofascial release. I make sure to assess the whole body, but focus on upper thoracic, upper traps, mid traps too, because they go all the way up into the base of the skull, all the neck vertebrae, the first at least 7 vertebrae of the thoracic, and then all around the upper neck where it meets at the skull itself. Sternocleidomastoids are also equally important. And you got to make sure the first rib down here is dressed also. When you get the scalenes that are involved, it's going to pull up that first rib and it's going to start compromising blood flow up and down, and that's going to cause lymphatic circulation issues and arterial blood flow up to the skull, including neurological issues too. So, and when all that's present, you usually have disc herniations going on in there and many other factors.
So can you demonstrate how you would treat it?
I would do a thorough eval if it was our first visit. Always motion test. This is the upper thoracic, and she's tight. She's tight in the right side, T2 through 4, basically right in here. So I'm gonna keep that in my mind. Back. So I like to get my hands on it first to see what we're dealing with. I'm gonna jump up to the C1, kind of motion test, left side, then right side.
And you're doing what again? What test?
Not really a test, but just kind of motion testing. So I'm just kind of springing the vertebrae to see if they're moving. So C2 feels tight there. C4, right? Feel that? 5's okay. 6's okay. 7's okay. Now hop down here. Check first row. Pretty happy there. Not so happy over there. Spring the clavicles. A little restricted there. So, quick little assessment. She has some right rib, T2 through 4, thoracic spine restrictions there. It's wrapping around to the clavicle, AC joint, a little restricted there, a little bit restricted here, and then just some various spots in the neck, not too bad, mostly in the upper C spine and the mid, just that whole right side. One thing I like to do, right there feels all right, right there does not. Okay. Back, thoracic spine, left or right, it will fully unlock that whole neck extensor on that side because it's a reflexive pain coming from that area. So I'm kind of mixing three techniques at once just to turn down the volume of that right neck muscle extensor, rectus spinae muscle.
There's a lot of research studies that show just by treating thoracic spine, you can get the neck better. Just doing thoracic.
Yeah,
What are you feeling for in your hands or palpation-wise to know that you're getting results?
just a general what I call melting of tissue. It's not literally melting, but it just kind of softens up and becomes supple, and then I can spring it, and versus when I started, it was like a brick almost.
So the goal is to put pressure on it to the point where the muscle then lets go.
Yes, and I'm also following her breathing, which is very important, and slowly move my hands around and letting the tissue kind of go where it wants to go. So I'm really not just doing the Chapman reflex, I'm doing myofascial release, counter strain, and a little bit of visceral release with a Chapman's reflex, stacking the four techniques.
And what's the goal of strain counter strain? How do you know how to position them and what are you looking for?
There are various points in the body, and every point represents a problem, and then they're all broken down into different systems, and a lot of times they're almost overlapping, as far as where they're at. As you learn each individual system, about 100 points each, you're trying to go through and figure out which one is causing that. C4 is on her, C4 stuck that way. Which one is causing it to turn that one off to put C4 back where it belongs.
So if you could though, can you, for our audience, oversimplify it a little bit?
So instead of doing one single counter strain point, you might still be treating counter strain point, but you're also treating two other layers all in one technique. So again, it's all about how much can we get treated, maximum amount of treatment in a minimal amount of time to get the patient better as quickly as we possibly can. My hands kind of find the sore spots and just unlocking as I go, using multiple techniques, but all from the osteopathic umbrella.
So can you speak to what the patient will be feeling or experiencing while getting treated by you?
Sometimes they fall asleep, which is a good sign. Almost always they get off the table more relaxed, looser, less painful, more motion. I tell them all to drink a lot of water, very important. These techniques are not very well known, unfortunately. I'd say there's only maybe 10 to 15% of physical therapists that use them, but they're highly effective.